This episode of EMS One-Stop is brought to you by Lexipol, the experts in policy, training, wellness support and grants assistance for first responders and government leaders. To learn more, visit lexipol.com. That's Lexipol.com. Hello and welcome back to another edition of EMS One-Stop. I'm your host, Rob Lawrence, and one of the big ticket items that's been ongoing for some considerable time now has been and is recruiting and retention. And to help us talk about that today is a state EMS director, in fact, from Texas, and Joe Schmider is my guest. And we're going to talk about the small amount of money that they were given a few years ago in order to help this process along. So, Joe Schmider, welcome to EMS One-Stop.
Thank you, Rob. It's my pleasure and honor to be here today.
So the good news is that $21 million retention initiative is underway in Texas. The initial aim, I think, was to add 2,500 EMTs to the state, the Texas Recruitment and Retention Initiative. Fantastic. Congratulations. Well done. Let's go back, though. Obviously, you and I have been talking since the pandemic and have been lamenting about recruiting and retention. And so really help us understand the crisis that brought this amazing gift about.
Well, this was pre-COVID. We were seeing the numbers going down, Rob, a little bit. And then COVID just speeded everything up. And as healthcare needed more paramedics, needed more healthcare workers and facilities, then we lost even more people going into those environments and not in the back of an ambulance. So we just started looking at data and we were seeing about 40% of our certified people, licensed paramedics, EMTs, advanced EMTs, were not using their skills on an ambulance. And you say, Joe, how did you figure that out? Well, we just took everyone's numbers and ran it against the PCR, patient care records that we received. And as long as you filled out one record, you got credit. And that's how we came up with about 40% were not using it. So we worked with our associations here in Texas, the Texas EMS Alliance, the Texas EMS Association, and they went and met with some legislators and worked the room a little bit. And we got $21 million of federal dollars through the state to us for 2 years to put in place a recruitment and retention program.
So let's break that answer down into a few parts, Joe, because what you said has been really interesting. So obviously you are the state EMS director for the great state of Texas. You have access to a lot of data and a lot of information. And so the art or the act of going back to seeing who was doing what via PCRs, I mean, break that out a little bit for us and how you did that. And of course, maybe also who's doing a number crunching for you.
So we have a department we call the EMS and Trauma Registry section that collects all the data, not just from EMS, but also from trauma centers, cancer, all the different agencies that push data to the Department of State Health Services. And we work with them on a daily basis. And they simply just took the numbers. We matched up the numbers of people's certification numbers with us for state certification. We matched it up with their number on the patient care records. They ran that data, and that's how we came up with the number of about 40% were using them. And as I said earlier, you just had to be on one patient care record to get credit for still running on an ambulance. And, every ambulance, we get about 5 million records a year submitted to the state from EMS. We provide about 9% of the data that goes into NEMSIS for the whole country. And it's a great resource and it tracks our trends, what care we're giving, but also we can track the personnel that we have.
I mean, that's firstly a great hack for anybody else that's listening to try and identify who's doing what and when. So just based on that answer, what at the time were your theories about, well, where the heck are the rest gone then?
Well, we just assumed, and I think we're pretty close on that, or pretty certain on that. They wanted other parts of healthcare. I've been doing this for a couple of years now, just hitting 50-year mark. After a while, you get tired of carrying people up and down, in and out of cars and stuff like that. So why not look at other parts of healthcare where you can have a better environment where you're dealing and giving care and using the skills and the knowledge that you have. So we hated losing those people, but on the same token, it's a progression of where you go in healthcare.
Okay, so the second part of your answer there, sorry, this is turning into a bit of a dissection here, but what you
Sure.
said was fascinating. So you are, to all intents and purposes, a civil servant. You don't have that sort of lobbying power, but then you said you had a number of state associations who obviously, and I'm involved with a number of national and state associations, as we all know. Then it's time to go to the big house and with cap in hand to identify the problem. I mean, how did that kind of work?
Yeah, we met with as I said earlier, the Texas EMS Alliance and the Texas Ambulance Association, and we all were seeing the problem with staffing. And so they worked with us. We knew what they were doing. Obviously, we're not lobbying. We can educate. We don't lobby. They don't really lobby either. They more educate. They went to a couple of representatives and said, "Hey, here's a real problem, and here's what we could do to help bring people back into EMS." And that's where the $21 million came from. It was a 2-year project. We knew from the beginning. And I'm thrilled to death with my staff. We didn't hire a project manager. We did it internally, working. I remember at day one meeting, bringing everyone in. I said, we have to be successful in this, and we were meeting daily, several times a day, on developing this.
So you've got the support of the associations, who are also probably the employers. You've got the support
Sure.
of the politicians. Obviously, you have the drive, determination, the motivation with your team at the state to do this. And so you've got all the players on side, right? And so now, what are the aims and the objectives, and indeed the project timeline from that point where the politicians went, "Yep, great, let's do it."
Sure. Our goal was to get 2,500 more people into the system. That was our initial goal. We had 2 years, from September 1st of 23 to, 22. I'm sorry, December 1st of 20, or September 1st of 22 to December 31st of 24. So we had this 2-year window to make this all happen. And we worked together on what it would cost. So we pushed out 3,252 scholarships over that time period. An EMT scholarship was worth $2,000. An advanced EMT scholarship was $3,200, and a paramedic scholarship was $8,000. And it went right to the education program, not to the student. And you had to complete everything within 1 year from the time you started until you took the national register test and got up and running. You had 1 year to get that done. And then for 1 year after that at the EMT level, and 2 years after that, they signed a commitment that they would serve in the back of an ambulance at least 96 hours a month. And it could be a paid position or a volunteer position. It didn't matter, but you had to do 96 hours a month for 2 years. And we're auditing that. They'll get a letter from us saying, "Hey, Rob, you got your scholarship. How you doing? Are you still working in the EMS and in the back of the ambulance?" And we can match it up to the patient care records also that are being submitted to us.
So with all of that, then you can actually, so you've identified the candidate or the student, you've given them the funding, they've gone through the training, and then you can actually see the physical result of their training, education through patient care all the way through. So it's kind of a soup to nuts measurement and process. Um, and I'll ask this question again later. But so, what are there results, outcomes, and data and stats that now say, "Yep, money well spent"?
Well, the one data set that we can say, and I'm thrilled to death by this, is that at the end of 2019, we had 68,461 certified people. Today, we have 79,376 people. So since the end of 2019, beginning of 2020, we've increased the workforce by 10,915 people. Which, see, remember, we had the scholarships with one part of this, but we also spent $1.5 million on a campaign, an advertising campaign throughout the state of Texas. And we hired a media company, GDC, out of San Antonio, that developed commercials, billboards. The use of social media was incredible. 500 million views over a course of the 2 years, which was 50 million views. I'm sorry, 50 million views over 2 years, which was an incredible number. We never expected that.
So again, you're about to send me down another rabbit hole here, which is a good one though, Joe. That of course we often get accused of not being able to promote ourselves, sell ourselves, tell our story. And yes, you hired in the professionals to do that. But what approach did they take? What was the unique selling point in the TVs? And please don't tell me it was, people walking in slow motion out of burning buildings. I mean, what was the hook that you used?
Sure. So the first thing they did was they put together 4 focus groups throughout Texas. Some in the valley, which is down toward the Mexican border, up north in the rural areas, and the 2 urban areas, San Antonio and over to Houston. Excuse me. And talk to EMS people on why you were in EMS and what kept you here and all that kind of stuff. And then they met with general public people and said, what would make you interested in joining EMS? And from that, we learned a lot of information. I mean, it's a new world. I took advertisement back in 76 when I was in college. And it's a little bit different today. Do you know, Rob, you have 30 seconds to get your message to whatever message you're getting out. You have 30 seconds to make that. And which I never dreamed that. And you really need to grab someone's attention to make them want to do this. And we did a photo shoot for 2 days for 2 1-minute commercials that aired on social media, on TV, and all kinds of different medias, avenues. It took 16 hours to make 2 minutes of video, but it was done well. It's done very professional. All of the players were EMS people, and I watched the one gentleman open and close a door for 1 hour of Hamilton. Open and close. But it makes sense. And I think the one message I really would like to get out to the world, when you're talking about recruiting people, we learn from GDC that the first thing they do is go to the internet. That's no surprise to you. It's no surprise to me. The second thing they do is they watch us as EMS professionals. Do I want to work with these people? Do I want to be a part of this? So I spoke throughout Texas on this, and I said, I did a cancer walk years ago. Coming to the end of it, there was the ambulance in case someone got hurt, and these 2 gentlemen were standing on the back of the truck smoking a cigarette. And I went up to them and I said, "Are you kidding me? This is a cancer walk. What message are we putting out when we do stuff like that? When we park the ambulance in front of the door of the grocery store while we run in to get something to eat, so then an 85-year-old woman has to walk around us to go in. It's what we're putting out, the image that we're putting out. And we just got to do a little bit better job if we want to keep recruiting people and keeping them in business."
You make an excellent point there, and it's also been thematic, certainly in this last run of One-Stops I've been doing, not only about the leadership, but obviously the fact that we as EMS providers in a massive billboard that's called an ambulance are on display the whole time, and people are watching, even when you think they're not, and you're on the Ring door camera, you're on somebody's iPhone, you're on the closed circuit television, we're there on permanent display. And as Doug Wolfberg calls it, it's performative EMS these days. We are the ones inside the soap opera, if you like. We're on the television. We're being watched the whole time. And so you make an excellent point. And I think there's some takeaways there. And did your consultants openly publish this report about who we are and what we do? Because I think that would be fantastic to share that if we could do that.
Yeah. Everything that I'm talking about, Rob, is on our website.
Excellent.
It's public accessible to anybody and everyone. And even our commercials that we made, our billboards, all those things were made generic so that anybody could pick it up, put their name on it, and run with it. one of the things we learned very early on, there isn't a lot of pictures of EMS from the USA, a lot of European pictures, but not a lot from the USA. So we put all those pictures up there. People can use them and abuse them and, do whatever they want with them.
That's great. There's been some criticism in social media recently of US-based EMS reports coming out with a good old-fashioned, UK, which delights me, obviously, but UK ambulance, European ambulance, totally inappropriate and doesn't set the right scene. And that's on the front cover, so why would you want to open it? Anyway, that's enough about that. Those are some great points that you brought out there, Joe. And of course, if you're watching on YouTube, on the YouTube channel, or on video on the vodcast right now, of course, what I'm doing right now and have been is putting up the images that Joe was talking about. Obviously, if you're listening to us on the Apple platform podcast or wherever you get your podcasts, of course, please come across to YouTube and have a look, because you can see us and obviously the charts, graphs, and images. At that point, we're going to have a quick word from our sponsor.
I was looking for a career where I can make a difference in people's lives and advance my own. I found it in emergency medical services. As an emergency medical technician, I have a fulfilling, meaningful career, and I got certified in only 4 months. EMS careers offer job security because there's always a need in our communities. Visit ems.texas.gov to volunteer or launch your career.
Lexipol empowers first responders and public servants to best meet the needs of their residents safely and responsibly. Serving more than 2 million public safety and government professionals in over 8,000 agencies and municipalities, Lexipol offers a range of solutions that includes policies, training, behavioral health resources, news and analysis, and grant assistance services for law enforcement, fire and rescue, EMS, local government, and other agencies dedicated to public safety. To learn more, visit lexipol.com. That's LEXIPOL.com.
And we're back. And thank you to my voiceover artist, Jim Dudley, of course, who presents Policing Matters over on Police One. Also, please make sure that you like and subscribe on the platform that you get your podcast or your vodcast from. Hit the subscribe button, or if you on an iPhone, hit that little check mark on the top corner, and you subscribe, and every time an episode of EMS One-Stop drops, you become notified that we're here, and you can listen in or watch more. I'm talking to the State EMS Director today for Texas, Joe Schmider. We had a fantastic first half talking about the $21 million state, we can't say grant, we're going to call it allocation, in order to enhance training. We've heard that the overall EMT operating numbers in Texas have improved, which is a good thing. And we've talked about how we advertise and make people aware, and maybe even entice people to come and do this amazingly noble vocation. But of course, Texas, Joe, is a huge place, and you've got a lot of space. But of course, that space has people in it, and those people need emergency medical resources. And so how did you use the training, education, and the money in order to make sure that you are equitably distributing the qualified and the trained staff?
Sure. So Rob, we have 22 what we call regional advisory councils throughout Texas. And we did a formula up front, so everyone got funding to offer scholarships. And then what we said to everyone, two things had to happen. They had to be, the scholarships had to go to underserved areas and recruiting people and to take care of that. So, and the way we defined underserved, either they can't get an ambulance on the road or there's a long delay. And by giving this scholarship money to somebody, it's going to put a person in the back of the ambulance, which could increase the amount of ambulance coverage within an area. So we wanted to see that it was being used. And that's why we linked it to the 96 hours a month. You had to either volunteer or get career, and you can move around. So if I got a scholarship and I was in Rack A up in the Panhandle, right in Oklahoma, and I now have a reason I had to move down to Rack V down on the border of Mexico, I can do that as long as the two racks communicate with each other. And it worked. And it was just a lot of people. Right from the beginning, we always wanted to find a way to say yes and not no, and benefit the program and benefit the people. And it was all about the patient at the end of the day.
And so do you feel that now those more rural areas are better served? Of course, we see stories around the country, of course, that not only a lack of ambulance services is a challenge, but of course, as rural hospitals close, of course, what that means is the distance you have to take somebody increases, and therefore the loop time increases, and therefore, cover diminishes. And so, hopefully you've gone some way to, refilling those voids.
Yeah, we can run the data and tell exactly where the students went in Texas. Where do they increase numbers and those kind of things? Now, let me be real honest with you, Rob. We have problems just like every other state, especially in the rural areas, getting healthcare out there. But this was just one solution. It's not the total solution, but it was one way of getting more resources there. And we're going to continue working with the local government and the local people on, because we have deserts in Texas. There's no doubt about it. There is places where EMS can take an hour to get there, and and I know that's way too long. But there's no magic crystal ball out there. But it's one part of the solution, and we'll just keep working at it.
So, in terms of looking forward, how have measuring success, right? Obviously, that's a lot of money to go into the system. I think what I've heard so far is this is money exceptionally well thought through and exceptionally well spent. Is it continuing, or has this now really been the sort of pump primer that's got things moving again for you?
So there is a movement right now with the two associations and trying to get additional funding for scholarships going into the future. Our legislators are in session right now until the end, to the beginning of June. So we're looking at that. But we're now really focusing more at our conferences and speaking to groups on making sure we retain these people. If we put all these people in and then we don't keep them, and people leave the industry for two reasons. And they're pretty equal, and the data supports this. They leave because of money, or they leave because of the way they're treated. And depending on which survey you look at, it could be money be the first one, the way they're treated, vice versa. But we really are enhancing their education. At our conference last year, we had a lady from HEB, which is she was the vice president, senior vice president for HEB, which is a huge grocery store chain here in Texas. Now you say, why were they coming to an EMS conference? The reason we brought them was because they reimagined themselves, because they were losing staff. They were losing customers because the staff was not happy and not satisfied in their job. And they redid what they did. And we thought, wow, maybe we can learn from them. And we did that. And we had a conference, 4,000 people sitting in the room, and they learned from what HEB did to improve their image. And as you know, HEB just became the best place to work nationally in the grocery stores, something like that. I saw that online not too long ago. But we got to keep doing that kind of stuff. We got to make sure we retain, and we'll have the numbers. We certify them all. We'll know where they're at and all that kind of stuff. So we'll keep running the data to make sure we're keeping the people.
Again, a number of things you just brought out there. Obviously, we don't have a monopoly on these issues, and you're quite right. There are external, whether it's a supermarket, whether it's any other part of industry. Retaining people is absolutely key, first of all, and obviously working out how they did it is a great clue to work out how we can do it. The survey, don't forget, have a look at the What Paramedics Want surveys going back 24, 23, 22. The What Paramedics Want survey for 25 is open right now, so you can follow the link in the show notes and go and take that. You're right, Joe, that those surveys, not only what paramedics want, but actually what firefighters want and what cops want, recruitment, retention, funding, and having a great boss are top of the tree. And also further resources on One-Stop. Catch the episode very recently with Robbie McHugh and Lisa Giaruzzi from the EMS Leadership Summit, which is just about to kick off as well, by the way. And they are looking at these very, very discrete and pointed issues as well. And so this is all coming together quite nicely in terms of the content you can get on EMS One-Stop. So thank you for raising that.
You and I attend a meeting every couple of weeks, and from all during COVID, one of the things we all learned was the stress on our workforce. So you were able to bring in the leadership from the UK to talk to us, and they had wellness programs. And out of that in Texas, we have Wellness Wednesday. So every Wednesday, every single EMS provider in Texas, every person gets a message from our office. And it could be take care of yourself, exercise. And the ideal, it's two purposes. We're giving you something quick. It's a text message. We're giving you something quick to say, hey, this is how you can take care of yourself. But the bottom line is I want them to know that we care about them, that we really want them to succeed in this business. So that's us all working together for the betterment of EMS and for the workforce that we deal with every day.
That's a fantastic testament to our friend Darren Mockery in the UK, who joined us for a number of meetings during the pandemic as we exchanged ideas and information. And I'm so pleased that you carried that on. And Darren's actually a listener. So there you go. You've left your legacy there, Mr. Mockery. So before we come to the end, Joe, the final question I usually ask is there anything I've forgotten to ask or anything you want to tell us?
This was a great process, a great opportunity for EMS in Texas. I hope other states can learn from it. Our website gives you everything. Call me. I'll help anybody, give our advice on improving EMS. I remember saying to my team at the very first meeting, I said, we have to succeed at this. There's no option to fail. But I did promise them one thing. If we did fail, I'm taking the hit for it. I don't want them to worry about losing their jobs or any of that kind of stuff. They're dedicated people. We learned as we went. One of our commissioners has said it's like building an airplane while you're flying it. And that's kind of like what we did. We learned how to do that during COVID, how it kept changing all the time. But it was a great opportunity. And it was such an honor to lead a group of professionals that really did an outstanding job. Everyone working together for the betterment of EMS. So thank you for this opportunity today, Rob.
No, you're very welcome. And we've been mates for years now, and just to watch you lead your state is really refreshing. And for folk that were just listening or watching to that is the sign of a true leader. Joe has been leading from the front. Obviously, the team created the vision. They then went out and found the solution, obviously got local associations and therefore liaison and communication and collaboration involved, went to the politicians. Of course, there's a whole class in that in itself. And the one thing that stuck out for me is that working out what we actually need, to paraphrase, worked out what paramedics want in terms of getting people to come and work and recruit and be alongside us on the front lines. And obviously had a program that, from the numbers, has improved the lot of Texas. And that is superb. Joe, thank you for sharing your story. And if we want to get in touch with you, how can we do that?
So they can call me. Anybody can call me, and I'll give you my number. I answer it 24/7. No one's ever misused it. 512-484-5470 or joseph.schmieder@dshs.texas.gov.
Okay, we'll put those links in the show notes, but Schmieder is easy to misspell, so make sure you read the show notes.
If they say it right, I always get nervous.
As our friend Ray Barashansky always says, Barashansky, common spelling. There we go. That's how we get around that one. Joe, I know I'll see you in the next couple of weeks because I see you every couple of weeks. So, but for today, thank you for joining me and my audience. There's some important lessons there. Again, if you're watching on video on YouTube, you can see some of the stuff we've been talking about. If you're listening to us on the Apple platform or the podcast platform you are listening on, then click across to YouTube to see what's going on. Everything's in the show notes. The amazing resources that Joe talked about are linked there as well. So please make sure that you go off and research this one because there's some great takeaways and some great hacks for you, whether you're in a state office or indeed whether you're in a local organization trying to work out what you do next. So Joe, for all of that, again, thank you very much indeed.
Thank you for the opportunity, Rob. Have a great day.
So what a superb edition of EMS One-Stop. What an amazing guest. What a great leader with amazing vision and clearly a team behind him to deliver. So all of those things are what we need right about right now. So That was EMS One-Stop. My guest was Joe Schmider from the Texas Office of EMS. This has been EMS One-Stop. And until next time, bye for now.